So hi, everybody out there. My name's Lisa. I am the chair of the YDMA Women's Caucus, and I'm here today with Jillian Brelsford. She's a licensed nurse, practical nurse at Cambridge Health Alliance and a board member of the...
Sorry, I'm a registered nurse.
Registered nurse, sorry. I mix those up sometimes. Thank you. She's an expert, I'm not. And she's also a board member with the Massachusetts Nurses Association. Correct on that one?
I am currently serving. Yeah.
So Jillian's one of the many healthcare workers who find themselves on the front lines of the coronavirus epidemic. She also works at what's called a safety net hospital, which are increasingly under threat of closure even before the current crisis, and serving the most vulnerable and at-need people in Massachusetts. So thank you for your time, Jillian.
Thank you.
So can you just explain to people what a safety net hospital is? I know what that term is, and I don't know if a lot of people actually do know what the term safety net hospital.
Definitely. So safety net means that we're legally obligated and organizationally mission driven to take care of patients regardless of their ability to pay. So that means a lot of our patients are uninsured or underinsured. A lot of folks are on Medicaid or Medicare. Many of our patients, similarly to our workforce, are immigrants and people of color. And Cambridge Health Alliance, we're actually a public health and hospital network. So we're comprised of 3 hospital campuses. Those are in Somerville, Cambridge, and Everett, as well as numerous clinics. And CHA actually operates the Cambridge Public Health Department through a contract with the city of Cambridge. So Cambridge school nurses are CHA employees. The funding system is complex enough that I'm not qualified to describe it in detail. And the reason I keep saying our is because my sense of identification with our organization is just that strong. It's not because I've been designated in any formal role as a spokesperson for CHA. I think that my best role, honestly, and thank you for giving me the opportunity to fulfill it, as a public sector bedside nurse, aside from doing the very challenging patient care work, the clinical work, which I'm doing approximately 50 to 60 hours per week currently, and my colleagues in critical care are doing more, is to speak honestly about the challenges that I and my coworkers are facing in our efforts to provide the best care possible to every patient we meet, because that's what we're here to do as nurses, and that is what we're about at CHA.
Great. Well, thank you so much for what you do, and again, for taking the time, because I know that you have a hard job, so taking your day off to talk to people is great. Can you talk a little bit about what your job was like before the COVID-19 crisis, just to give people kind of a sense of, again, like what it's like to be on the ground working with those vulnerable populations?
Absolutely. It's wonderful work, and it's tough work, and it's heartbreaking, backbreaking work. And we're so privileged to be able to do it. I chose to work for CHA back when I was a nursing student. I was in nursing school. I came to work at CHA as a nursing assistant and also a per diem secretary, because I knew from the beginning, from when I first started my nursing career and went to school, was that I wanted to be part of a mission-driven public health organization with the values that CHA has. And I'm incredibly proud to work for CHA. I continue to maintain that we're the type of organization that shares such a sense of contract with the public. I think it is very possible we might have prepared for a pandemic if we had had the resources. I think that we might have stockpiled and planned and researched and figured out what to do before the disaster struck. And I think that's part of what makes us unusual and special in the Massachusetts healthcare system, which is by and large privatized at this point and operates at the highest levels in accordance with the ruthless ethics of profit maximization that all big industries do. And that's not CHA. The slogan at CHA is care to the people, and that's what we're trying to deliver. I've always felt a really strong sense of shared purpose with Cambridge Health Alliance, though I think we have a lot of work to do going forward, and there are a lot of lessons we're learning in the course of the pandemic that we're going to need to incorporate into our organizational philosophy moving forward. And I don't know, I mean, to talk more about what it was like to work at CHA before the pandemic, I'd say that Resource barriers to best practice provision have always been an issue at organizations like ours. One of the greatest concerns we've had during the pandemic is insufficient infection control in the context of very hardworking housekeeping staff being overburdened. That's been a problem all over the place. Rooms where COVID patients have been housed really need to be cleaned in order to be clean. Sometimes the next patient we admit is a person who's waiting for test results and isn't necessarily COVID positive yet. So we've had grave concerns as bedside workers about the possibility of people catching COVID in the hospital setting. Our concern around that is profound. And not everyone who's making admission flow decisions is necessarily aware of what we're up against like on the floor and in the context of our actual practice environment. We're COVID central. Almost all of the patients on our unit have been COVID positive for the past several weeks. But the truth is, even before the pandemic struck, it was 100% ordinary in the course of a day's work at my hospital to provide patient care while negotiating my way around privacy curtains that are very seldom cleaned and are visibly stained with stool and other substances. That's not, I'm not making a dig at my hospital. Like, I'll say it again and again, I love the organization I work for. And that's what it's like to live and to work in a society that impoverishes its public sector. So it has been 100% ordinary pre-pandemic to encounter broken equipment in rooms, and the facility itself is old. Some of our patient rooms are not just double rooms, but are actually triple rooms, which is fairly unheard of in Greater Boston as far as acute care is concerned. It's almost unfeasible for a patient to get a good night's sleep in a triple room that's housing two other acutely ill people in it. So I think the complicated message that I want to convey, and that I hope I do a good job communicating, is that CHA was at a material disadvantage before the pandemic struck. Certainly did not have cash in offshore accounts like some other institutions did. And in some ways has done a much better job than better resourced institutions in terms of waging its pandemic response and protecting frontline staff. For example, we're not moving to reduce critical care beds the way the steward system is currently doing in at least 2 facilities. We're not making opportunistic moves to furlough or reduce paid staff like the way some other hospitals are doing, although of course there's still this ongoing issue of attempts to close the Somerville Emergency Department. That's still a problem. And CHA has made a good faith effort to make N95 respirators and other forms of protective equipment available to frontline workers. CHA is currently exceeding insufficient CDC guidelines for protecting healthcare workers from COVID. And we can talk more about how that's playing out for us who work on the inpatient floors, but some facilities aren't even trying to do that, and CHA is trying. So, I don't know.
That was good.
I can go on and on. I have so much to say about it. I mean, I have plenty of critiques to make as a frontline worker and a registered nurse about our lack of formal inclusion in pandemic response planning and implementation. The fact that some of the safety risks we faced were indeed avoidable. For example, we could have been permitted in the early weeks to wear equipment brought from home, which JACO is now recommending employers allow healthcare workers to do. So there were missed opportunities, and we experienced unnecessary exposures because of that. And it is our responsibility to not let that be forgotten so we can learn from it as an organization. And I'm very determined to play whatever role I can play as a frontline worker in helping to assure that all opportunities are duly taken to maximize patient care effectiveness and protect our workforce. Because if higher level problem solvers are too busy planning the pandemic response to include frontline workers in that process, then opportunities are going to be missed, and part of the point is being missed.
Thank you. That was great. So one of the things that I think you kind of talked about a little or touched on is that you were actually able to talk about what's going on in your facility. Many healthcare workers and frontline personnel, we've seen, reports in the news, have been fired for raising concerns about their working conditions. Can you talk a little bit about why we're able to even have this interview?
Definitely. I'm able to speak frankly on these issues because I have the support of a strong union and I have access to collective bargaining services. And that is 100% the only reason why. I'd say it's never been clearer to me before than it is now that all workers need representation from a union. And that is partly because, part of why that's never been clearer to me than it is now is because a huge portion of the people who are being admitted to our hospital incredibly sick with this virus are essential workers, just like CHA employees. Similar to us in nearly every way. Many of them are people of color, all of them are working class. A surprising number of them are under the age of 50. And the people who we're seeing getting sick and coming to our hospital are grocery workers, Amazon workers, airport workers, healthcare workers, long-term care facility workers, the type of workers who often do not have the protection of a union or the option of speaking openly to their employers or to the public about the circumstances of their work or lack of protection in PPE that exposes them to COVID-19. So these are the people who me and my coworkers have been caring for in isolation rooms without the benefit of full protection ourselves much of the time. And this is the most powerful experience of learning and solidarity across industries and communities that you could possibly imagine or come up with. So this has been a really terrible but a really profound experience of essential workers caring for other essential workers who are sick with COVID-19. So yeah, I'm incredibly privileged to be able to have this conversation with you and put it on the internet. And for anyone watching, I want to be very clear. I am not here to drag the organization I work for and love through the mud. I'm here to speak through our patients because many of them do not have the latitude or security to speak out in this way about what's happening to them and their coworkers.
Thank you. So you mentioned PPE, which for people who don't know stands for personal protective equipment, correct? And can you just kind of, I want to put in real terms for people what that means. So can you kind of walk through like what it means to get into your the gear when you walk into the door, and what are the different steps you have to take to keep yourself safe before going into a COVID room?
Definitely. I can talk, I'm going to walk you through exactly what I do, which is variable depending, even within the same organization, depending on the area you work in and depending on the policies that currently apply to your work area. So what I'm conveying is not necessarily the level of protection that all workers who are interacting with patients are currently getting. So my routine is I arrive at work wearing a self-supplied cloth or procedure mask. That's what the governor's office and the Department of Public Health is currently recommending. So that's the correct thing to be wearing in public. So I arrive to work wearing that. I come into the lobby of my hospital and I do hand hygiene. I use hand sanitizer. And then I go to the picnic tables, which are currently set up in our lobby, which have paper sandwich baggies set up on them with our names on the bags. And I retrieve one of the bags with my name on it, which contains one of the N95 masks, which I have used on previous shifts and which has been cleaned with experimental procedures. After 12 hours of unrecommended extended use, it's then cleaned with an experimental procedure, and I use it on subsequent shifts, presumably until it deteriorates or falls apart. This is all new. This is not how N95s have typically been used. This is a very courageous, creative, stopgap emergency N95 for use program, which CHA has come up with, which is admirable and is not a permanent solution. Then I get my temperature checked. I go upstairs, I put on my N95. I go to a converted family conference room, which is currently housing our Tyvek suits that we have access to on our unit. So I don the Tyvek suit according to protocol. The suit's fastened with a zipper and an adhesive strip. And per instructions, I do not use the adhesive strip because if I did, the suit would not be able to be cleaned and reused. So these are also apparently single-use items which are being cleaned multiple times for reuse. And this is the nature of the supply chain crisis we are facing, which is not specific to CHA. And before I enter a patient room, I also don a face shield, which was manufactured by a community volunteer, thanks to CHA's mobilization of community resources. And I put on disposable gloves.
And then after you meet, so after you've done all that, you would go meet with, presumably your first patient. What's kind of, once you do that, do you change, what's the changeover between patients that you're able, and I understand that like there's limited supply because of supply chain. So it's definitely, it's not a CHA problem. It's not a Massachusetts problem. It's a global, or in America, it's a global problem. But I guess I just kind of am curious about what that means for, what you're doing in between and what you're able to do to keep yourself safe.
So between patient rooms, we sanitize the outsides of our suits by hand with liquid disinfectant and reusable wipes. And we do not actually take off the suits more than once or twice per shift. We have to remove them in order to use the bathroom or enter areas where we can eat. We have to remove them completely in order to do that, and then don a new suit. You never put on a dirty suit you've taken off without it being cleaned in some manner first. So we wear the suits for a long time. They are hot. We find that we have to stay well hydrated in order to avoid feeling lightheaded while we're working, and which of course is difficult when you can't use the bathroom regularly. So there are major challenges associated with using them. I'd say the consensus on the unit is that we do feel much safer and morale is much higher with the Tyvek in use than we were when the active policy, which was active for a time, was to reuse disposable gowns multiple times between multiple caregivers within the same shift. So we're doing much better than we were before.
That's good to hear.
Yeah.
So I just have a couple of last questions and then I'll let you go. What's like one of the best things that the general public can be doing right now to support you and your coworkers?
So many things. I mean, we are all in this together. So anything that you do to support your community supports our work as frontline healthcare workers. So all the obvious things, stay healthy, stay indoors, support your friends and neighbors who are struggling under the pandemic economy, join a mutual aid network, work for your community. If you're lucky and you can afford it, donate your stimulus check to an undocumented person who can't safely apply for unemployment benefits. Get active in your union if you aren't already. Pay attention to our voices in the media and to the media that we're generating. Stay posted for potential public actions from frontline healthcare workers and do what you can to safely support us. And if you have wealth to share, consider using our union's online donation tool so that the Massachusetts Nurses Association can buy PPE to distribute directly to nurses who aren't getting enough from their employers.
Yeah, and we'll put a link up about that. But as the Massachusetts Nurses Association is collecting money to buy, and that goes directly to frontline workers across the state. So it's a great way if you want to make sure that your money is going directly to buying PPE for healthcare workers. Just kind of as a follow-up, like people have been, shut inside for over a month now. A lot of people are getting really tired and stir crazy. What do you say to people who are not social distancing or are becoming skeptical of this as a strategy?
Sorry, what's that?
So I know I didn't. This is a little bit. But what do you say to people who are like either not social distancing or are skeptical of the strategy, or just getting stir crazy and kind of want to start bending their rules a little?
I think the difficult thing as far as like adequate public health messaging and response goes going forward is the fact that we've managed to mobilize a high enough level of public intervention to avoid some of the absolute worst fears we had about how bad this crisis could have been. So I think what we're going to start seeing more and more of is voices emerging saying this was a false alarm. None of this had to happen. None of this damage to the economy had to occur. Whereas if we hadn't mobilized and those terrible, like all of like the hospital overwhelm had been as bad as it could have been, then we would have had the proof that the mobilization was necessary. So it's a bit of a public messaging catch-22, and we're going to have to be, I think, very vigilant, especially as the weather gets warmer and people want to get outside more. I'm not sure. Yeah, just stay really on task about maintaining our message and making sure that we don't undo all of the efforts we've already made.
I mean, I think that's something that seems to have happened with like SARS, and it's like they did a bunch of really good measures, and then it didn't turn into the epidemic that it could have, and so everybody thought, hey, it's fine.
Right.
It's
like,
no,
the fact that things are not as bad as they could be proves that the things we're doing are working to some extent. So yeah, we need to keep it up.
So just for people who don't know this, I actually met Jillian when I was working. Well, we knew each other a little bit before, but we worked together when I was working for the M&A on the Question 1 campaign about safe staffing. I remember during that time, nurses were raising this issue of the fact that they didn't think we were prepared for a pandemic. And I was kind of wondering, when this is over and we are looking towards the next thing, what are some big policy things that we can be doing to improve public health and to make sure that we're like not behind the ball on things like pandemics?
Definitely. Well, fortunately, yeah, even though we're all stuck inside still for the most part, we don't need to wait until this is over in order to start talking about that and acting on it. In fact, the jury's out on whether or not this will ever be completely over. It all depends on the virus and the technological and public health solutions that are generated to combat it. So I think what we've been doing and what we need to keep doing, and we need to incorporate all the messages from this to the max in order to further invigorate our efforts, is to make public health values like those we have at CHA universal, and then funding them in the right way. So we need to hold government accountable for pandemic preparedness. We need to have a really functional, coordinated public health care system that has the right values and has the capacity to coordinate resources effectively. We need true Medicare for all. We need a robust national stockpile of equipment as just one important piece of the puzzle. And we should, to go back to the earlier part of our conversation about union representation, we should be organizing workers across every industry to have union representation and a voice on the job, because that's how real solutions get made. And frankly, we're going to need to have a real, true truth and reconciliation commission formed in this state to review what happened and how it happened, and make sure that we incorporate all of the lessons we need to in order to move forward in the best possible way.
Well, with that, I'm gonna thank you, Jillian, so much for doing this. You're a true badass, probably one of the most badass people I know right now. And again, we're gonna post the links for people to contribute if they want to the M&A. Also, you can reach out to me or YDMA if you have any questions, and we will, see if we can get answers to you. Thank you so much, and have a great day.
Thank you so much for your work. Thank you.
Yeah, you too.
Okay.
Bye.
Bye.